Hi everybody. Today we are here to answer the question, as a caregiver, how on earth do I figure out what is wrong with my elderly parents? Especially if your parents are resisting help, if they're avoiding medical care, and they're refusing to do anything to help themselves, even though you are bending over backwards to try to prevent or stop what you see as a disaster waiting to happen. If this is your experience, you're probably in good company with a lot of other caregivers. In this video, I will offer reasons why it might be difficult to get care for an elderly parent and steps that caregivers can take, especially related to health and medical care. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, a lot of hope, help, support for caregivers and aging adults, my caregiving library, my blog, my podcast, The Caring Generation, online courses, and so much more. Please press that share button, press the like button in this video so that other people can find hope, help, and support. Let's talk about what caregivers can do when you see the health of a parent failing and you're just not sure really what to do. Now, in this video, my assumption is that your parent is going to agree to see a doctor. If seeing a doctor is off the table because mom or dad doesn't trust the medical community, or maybe you don't, then something will eventually happen where there will be a choice to accept medical care or not. I wish I had a better answer for you, but that is what I've seen with my clients and the families that I've worked with when loved ones have refused care. Something eventually happens sooner or later to change that situation, and then other decisions have to be made. It's not ideal for the caregiver, but a lot of times it does happen. So let's begin with a few reasons why it can be difficult to get care for aging parents from the medical system. The first issue is that information gathering is extremely important. So doctors rely on the caregiver or the patient to provide enough information about what's going on to help them make a diagnosis and to help them treat a person. So for caregivers, the more involved you can be in your parents' medical care, and I mean attending appointments with them, getting medical power of attorney or a HIPAA release so that you can talk to their doctors, look in their medical chart, read their records. The more involved you can be and the more detail you can know to keep track of their medical care and to ask the right questions and to make sure treatments are followed, the better care your parents will get, and for you, the better care you will get when you are the person navigating your own health. This is a total situation where details do matter. I have seen situations where teeny tiny details were missed, and that made such a huge difference in the care that somebody got. You know, a medical test was missed and a health concern got worse. Or somebody said, well, the doctor never told me about this. Well, it's really up to the patients and the consumers to ask the questions. Doctors talk in terms that we don't understand. They say things, and they may be saying something really important in a lot of cases that unfortunately consumers just don't catch. So you've got to be very, very detail-oriented in providing information and asking questions. Number two, doctors in the healthcare system make errors. They may forget to call you about a follow-up or the results of a test. If you're having tests, if you're having medical follow-ups, you've got to be the person to call because sometimes they just don't. There's also a term called healthcare bias, and all of us have bias, right? We think that everybody is the same. So doctors tend to group people into groups, right? The elderly over here, women over here, other people over here. And they attribute similarities. But what happens if you are that 10% or that 20% who is not like everybody else in this group? Let's say that you exercise every day and you're super healthy and you take vitamins and you do all these things where all these people over here do not. Your health and your treatment is going to be very different from all these people over here. So it's up to you to explain to the doctor how you are different from other people. And I'm going to put this in the context of memory loss. A lot of caregivers will go to a primary care doctor and they'll say, "Doctor, something's wrong with my mom or dad. They're having memory loss." And most primary care doctors, without experience diagnosing Alzheimer's and dementia, will just say, "Oh, your parents just getting old. That is normal aging. Don't worry about it." Again, because they're lumping old people all together, and this is just what happens to old people. Well, this may not be what's happening to your parent. So you have to speak up. You have to ask for specialist referrals. You have to go above and beyond. Now, research. There's 6 common diseases that are misdiagnosed in the elderly. COPD, which is a breathing issue, dementia, Alzheimer's, memory loss, Parkinson's, heart failure, stroke, mini strokes, and heart attacks. So you have to be extra diligent in understanding health diagnosis and the treatments. And if what the doctor is recommending is not working, then something is still wrong. The diagnosis is wrong. The medications prescribed is wrong. The treatment is wrong. Keep going back to the doctor until the condition is accurately diagnosed. Ask to see specialists if you don't feel like you're getting an answer. This is your right as a healthcare consumer, and it's your responsibility if you're the caregiver for an aging parent or anybody in your family. The last concern is prescription drugs. Everybody thinks that they are, oh my God, a godsend, there's a pill for this. Well, there's a lot of drug interactions for the elderly. The more pills your parent takes, the more side effects they're going to have. It's almost as if prescribing one pill causes another health issue over here that then has to be resolved by another medication. Medications can only do so much. Combining medications with health interventions like exercise and activity, eating healthy, giving up salt, giving up things that you love that are causing health problems, ending smoking, other things. Those combined with medications can have a much more positive effect on physical and emotional health. Now, we all know that doctors are rushed, so it's important to prepare for doctor appointments. Know what you want to talk about, know what the outcome is that you expect. And if you don't get it from one appointment, set another appointment. And I know you're saying, "Oh, Pamela, I don't have time to attend all these appointments with my parents." Attend virtually, attend by phone. Make sure that somehow you're involved so that your parents do get the care that they need. So as a caregiver, it's up to you to be what I call a good historian. Keep records, get copies of doctor appointments, take charge of managing your parents' health, your health, know your test results, know what follow-ups that are on your list to do. Create a document that has your parents' medical history that you have at your fingertips. So if they have to go to the doctor or they're hospitalized, you can look up what medication they're on, when they had surgery, what their diagnosis is. And when you attend medical appointments, again, either in person, on phone, virtually, be able to very clearly recite what the problem is, or what we call the symptoms of the problem, right? Mom or dad is tired all the time. They're losing weight. They're not sleeping. They get dizzy when they stand up. And ask the doctor what needs to be done and what their recommendations are. And then understand what those recommendations are. And ask what happens, what does this condition look like in 6 months or 12 months or 3 years or 5 years? The more involved you can be in aspects of health and well-being, the better off your loved one will be, and the better off that you will be. You'll get to live the life that you want to live versus feeling sick and unhealthy and just not well all the time. Is this time consuming? Yes. Are you worth it? Are your parents worth it? You're the only one that can answer that question. Is the time that you put in showing results? Only you can answer that. I can tell you, though, that not having enough time to manage health concerns is the reason that health gets worse. You don't think that this little thing over here is a big problem until something happens and wow, it turns out to be a huge problem. And you think, oh, I should have paid attention to that, but I didn't. So, How do caregivers understand what's going on with the health of their parents? How do you take steps when you're not sure what to do, when you're trying to figure out what's wrong with an elderly parent? All of the small details are here in this video. Come back and watch it again. Share it with your parents who may be saying, oh, I don't need to go to the doctor. Oh, that's not going to get worse. Let's not worry about that right now. Help other people understand how important it is to take an interest in their health and to be as detail-oriented and involved as possible. I'm Pamela D Wilson. Again, my website, PamelaDWilson.com. A lot of education, hope, help, and support there. Like this video, like my YouTube channel, share it so other people can find hope, help, and support. Have a fabulous day today. I'll see you all again soon in another video.